Okay, so what I want to first do is just welcome all of you to our PRC Prevention Research Center Brownbag seminar that takes place once a month. And for those of you who are unaware, the Prevention Research Centers are a network of CDC-funded academic research facilities in the United States that study how people and their communities can avoid or counter the risks of chronic illnesses. And our PRC at Georgia State University is headquartered on the Clarkston campus at Perimeter College. And we work with community organizations, state and local governments, residents, and other partners in Clarkston, Georgia, to develop, implement, and evaluate culturally and linguistically appropriate interventions to address disparities and determinants of health for migrants and refugees, and to disseminate this work at the community, state, and national level. I'm pleased to welcome two and hopefully three guests. Our third will hopefully be able to join soon, Mohamed and Thomas. And as I mentioned, I'm hoping Ahmad will be able to join us as well. We had to shift a few of our panelists because of illness and work conflicts. So we are really pleased that Mohamed and Thomas are with us today. So I'm going to go ahead and I'm going to stop sharing so that we can see each other's faces a little bit better, and want to first just kind of mention the kind of format that I had envisioned for today. Generally, what I'd like to do is kind of proceed in a round robin with our two panelists, but I encourage Thomas and Mohamed and Ahmed, if he can join, to just jump in, when you feel it's fit to do so. And I also encourage any attendees to please use the chat function to pose any questions to our panelists and or hold those questions to the end if you want to unmute yourself at that point. Okay, so the first thing I would like to do, Thomas and Mohamed, is I would like for the two of you to just introduce yourselves, please, to all of us. I know some of us know you better than others. And specifically, if you could just mention your country of origin, the languages that you speak, and a little bit about the work that you do, in addition to the work you're doing as part of the PRC. So let me start with you, Thomas.
Hi, everybody. I hope you have a good year.
Yes.
Can you hear me?
Yeah, we sure can, Thomas.
All right, thank you. So this is Thomas Roger. Yes, I'm a Congolese. I was born in the Congo, but I grew up in Tanzania in a refugee camp. So I came here in 2016, and I sacrificed my time learning English a little bit. I had a little, and then I add the knowledge here when I was attending ESL at Georgia State Piedmont. So, and then also sacrificed my time seeing a lot of Congolese, Swahili speaking. They have a lot of challenges. I was trying to help them on how they can find something that they need, like interpretation to interpret for them, helping them schedule appointment at the hospital. Once I get a good chance, I got a car, and I was using my car to help them a lot, taking them to the appointment and to the store, because even if they still have access on a vehicle, but I still helping them and volunteer because they may arrive at the point that they need to express in English. So they need me, and I'm trying my best to help them whenever they want me to help. So I'm still helping them like a volunteer. So as we open like a small organization, that is our job, providing transportation, interpretation. So I'm the one who, the founder, and I'm one the volunteer on that organization. Yeah, that's about my introduction.
Great.
Yeah.
Thank you so much, Thomas. And Mohamed.
Good afternoon, everybody. I suppose it's afternoon now.
Good afternoon.
Yes, my name is Mohamed. My first name is Mohamed, last name is Mohamed. I suppose that makes it easy for everyone to pronounce. Yes. I'm a Somali, born in Ethiopia, grew up in several countries, of course, due to displacement, passed in Kenya for several years, Somalia and others. I've been in the country for almost 30 years now. One of the first few groups that were placed here in Clarkston, sometimes in 1992. And since I had passed a different country, and that was a former British colony, I was blessed to be able to, if you saw, a blessing to learn English and not realizing it was more important to the community, the few ones that were here, in assisting them in interpretation, translating, filling them some application or any forms that were required. So I worked with agencies for many, many years, either as a volunteer, part-timer, and so forth. And in fact, I worked as a full-time later on to an agency called Refugee and Resettlement Agency, IRC as well. But I've worked with RISA for almost 7 to 8 years as a logistics manager, picking people from the airport. Oh, what an exciting thing it was. The first face they used to see with so much excitement, not knowing what they are going to encounter. Here they come, find a fellow Africans speaking their same languages. And I think that encouraged me so much to be able to assist my community. I do speak English, a little bit of English, of course, a lot of Somalis and Swahili. And those are the main languages that I was assisting. And most of the refugees were speaking those languages. Currently working with another agency as a training specialist, bridging the gap from the, especially those refugees from other countries coming to a fast developed world where the industrialization, the methods of working, safety and recruiting and so forth. I'm blessed, and I think I'm very blessed now to be working as an ambassador. That's indeed an honor. So I'm working to this end. I have realized working there as an ambassador, God, if I'm to write, maybe I'll write a whole book, not realizing what impact we've been making, especially with the social medias and all the challenges up there with misinformation, and what impact you were able to be having that opportunity to be able to influence, advise, and guide fellow immigrants to a healthier and safer community. It's really a privilege. Thanks.
Thanks, Mohamed. And actually, that's a great transition to my next question. So maybe I'll just come back to you, Mohamed, since you were kind of already starting to speak to this, and then I'll go back to Thomas. So, I'm just interested in kind of what drew you to working as a COVID vaccine ambassador for the Prevention Research Center. Why were you interested in doing this work?
As I said earlier, I've always done different things within the community whenever the needs were. And I've been attached to the community for so long. I knew their challenges that I encountered and so forth. So I've been with the community for a long time. So when I was approached to do this, it was a no-brainer because I was doing that anyway as a volunteer. So and I thought that was indeed a privilege. And I cannot imagine what impact I have had. Maybe this will take another whole session to discuss this. What impact you've had up there, especially if you are a person of an influence, somebody they trust. They trust you even to fill up a form, leave alone put an injection on their bodies. So when they have somebody like you and you are able to convince them, talk to them out of the misinformation up there, and you're able to have that impact, it's really, really great. It's indeed an honor for me. And Georgia State, I wish they could understand what impact it had and what changes up there it had to make sure our people who are very skeptical of this so many stuff, and I mean, people are very skeptical of coming to other countries when they already knew it was a safer place to go to. Now, when they come here and with all skepticism, and Georgia State played a big role getting the right people at the right time, passing the right information to be able to fill up that gap of skepticism and be able to, and I'm proud, I'm very happy to be able to see a healthier community that I'm involved in one way or another within our community.
Mm-hmm. Yeah, great. Thanks, Mohamed, for that. Thomas, what about you? Kind of what drew you to doing this work with respect to COVID vaccination uptake?
Yes, first of all, I may say, before I joined an ambassador, before I became ambassador, yeah, I was like the one who had got a vaccine, and the one who touched this a virus. I know where it's come from and how it's affect our people in this community here in the Clarkston. And once I heard a lot of people had neglected the virus, they was taking the virus as something like a joke. So I feel inside there is a miss of information, there is a bad trusting, misbehavior that they are taking on the social media. I feel like I live with my own people, my dad, my siblings. So if they hear something about others that are saying, I know we'll have more percent of virus here in the classroom. I feel like how can I reach these people with a good information? How can I tell them the truth? Because they're not gonna believe. So they may think maybe I'm the one who already convinced by the doctor maybe. So I feel like I was starting the way on how I can help them. And I know they trust me a lot. I'm the one who helped them a lot of funding different things. So, and fortunately, I got the opportunity, and the first time I was being taught by Meg, so we may have some more trainings about COVID-19. I trust on this way, maybe I'm gonna get the truth and the good information on how I can tell people. So I attended some trainings at Georgia Georgia University. So that was good information I gained, and then I feel like I can reach the people with this true information.
Mhm.
Yes, that's give me something to be an ambassador.
Mhm. So I want to ask a little bit about the challenges of doing this work that you both have been working so hard at for many months now, as well as the successes. So maybe we could start with some of the challenges. And then I also want to loop in Crispin, who I know is not a COVID ambassador with our team, but has been doing a lot of this work in the Clarkston and nearby communities as well. So Crispin, I'll loop you in as well at the end. So maybe Thomas, why don't we start with you? You know, what have been some of the challenges that you have experienced in doing this work in the community around the vaccine?
I think the challenge was like on my first weeks, reaching the people with this information, and was trust. So the people was believing that I'm the one now sent by some doctor to tell them the thing that they still don't believe, the thing that is not true. Even if I was telling them this is true now, you have to believe this. This information come from trusted source. So if you believe such kind of information which is wrong, so now we're gonna maybe we're gonna die. So, so they didn't trust me on the first week. They was thinking maybe I was sent by someone. I gotta pay. They pay me in order to tell them those information. So about now, there are lies. Most of them now, there are lies. I'm telling them the truth, what is almost of people in Clarkston are now getting vaccinated. Now, I think now I gain the trust from them. Now they don't believe if I'm sent by doctor, I'm paid money, they pay me money. So in short, I may say the trust was not there among of my community in Clarkston. The trust. That's the challenge I faced on my first weeks. But now I think now most of them, they agree with me, and I'm taking a lot on the appointment, getting the vaccination. So that's I may say.
Yeah, that's such an important point, Thomas, about trust, which we know is such a critical component to doing the work that you guys are doing. So thank you for making that point. Mohamed, what about you? Anything to add from your perspective in terms of kind of what has felt like the most kind of challenging issues, or what are some of the barriers that you have experienced in doing community-based outreach around the vaccine?
Social media where our people so much excited to have the access of this new technology where they can have the information in their hands. They're having a phone. Everybody has a phone, and they can access this social media so easy. Social media has been a very, very in the beginning. Yes, up to now for some few has been the biggest challenge. Luckily, I had acquired trust, having worked with the community for a long time on voluntary basis, worked with churches, working with non-governmental organization for that long. Even when I was in work for the non-governmental organization, I'd always volunteered to do stuff here, and yeah, that the community required. So the trust to me was not of a big challenge, because somehow I was privileged by people talking about me for how many years I've been with this. And they will hear this from the church. They'll go to the pastors here, they'll go to the mosque. If there's any challenges, a sheikh in the mosque will refine and say, please go and see so and so, go and see. So I had already developed that. But the biggest challenge to me was social media. They're having this access to misinformation on the social media was a big challenge. Another challenge I found is that the people from Eastern Central Africa, of which I belong to, some of our leaders back home in the leadership of presidency were challenging this, were questioning this. So I was going an uphill, talking to them when you are a simple, small timer community advocate against an entire president or certain minister of another country, not just saying misinformation on this. That was a little bit challenging. It got easier as my community was being touched by death. So and so's wife passed away, so and so's son passed away. So they believed this existed. So the first few months, several months, they did not believe until it touched the community. If they realized several people were getting admitted or passed away, and they couldn't even see the bodies when they were burying. And in our culture, of which Thomas can also attest to this, different religion, but we have very common cultures where the bodies have to go certain rituals before they could bury, and they were not allowed to do certain things because of protecting the community and the families as well. So it touched them. They've seen the reality. So the first few months, they weren't believing in it, and they realized so and so son, so and so grandfather passed away. Based on this, we couldn't go to the body. Only few people were allowed to go. We didn't see the body. The body came in certain bag. We were not allowed to open, and all these made them realize, sure enough, this is here. The disease now it's here, and it's touching the community. The upper hill was the social community, social media, where there was a lot of misinformation, but the information we were getting assisted through Georgia State and CDC and all that information that we were acquiring and sharing with them isn't that, and therefore now it's getting better. We still have a lot of people out there. We still have a lot of people. Where I work, I have close to 786 Clarkstonians, 786 I have in one single, different shifts, but in one single, out of the 786 fellow brothers and sisters, associates, have family members. They have 3 kids, they have brothers and this. So I haven't gone outside the box. The 786 with brothers and uncles and this is keep on extending and multiply. So the percentage is getting much better, but we have some work to do, and thank for all the support we are getting out there. So much support. They already even started calling. Many people I've had so many nicknames from Eminem, because my name is M and M. Mohamed, they call MM, so they'll call you Momo. Now they're the COVID guys. So they've already nicknamed me. Have you seen Mr. COVID guy? And so I think thank for all the support and the knowledge we are acquiring from the partners, ambassadors, as well as the, of course, the university. Thank you so much.
You know, it's interesting because both Thomas, you and Mohamed, I think, you know, it seems like kind of a core commonality between what you both talked about in terms of the challenges that you faced in trying to raise awareness about the vaccine and increase confidence about the vaccine is really about trust and trusting people and trusting information, right? So Thomas, you were kind of speaking to kind of trust, kind of that, you know, at an individual or interpersonal level, that you were working hard and kind of facing some challenges around cultivating trust as you went out and talked to people. And Mohamed, you were kind of, it seems to me, kind of raising issues about, you know, people's trust of information that they were getting. You know, there's a lot of misinformation on social media that leaders in other countries, in people's home countries, were perhaps spreading information that was also perhaps misinformed or was misinformation in some respect. And you know, that there was kind of some spreading of distrust and misinformation. So to me, kind of what kind of came up for me listening to both of you was this core issue of the challenges of cultivating people's trust in you, in leaders, in information that they're getting from social media and from one another. And I just wonder, you know, Crispin, if you want to chime in here about your experiences in the community, if any of that resonates with you, or if you've had any different experiences.
The difference is the same. I mean, the situation is the same, where trust is a big issue. But what I just want to add to all that, what Thomas and Mohamed have shared, is also at the beginning, many people thought that COVID was not for Africans. But they thought that's for for people in the Western countries, but in Africa, we are not concerned by COVID. And as Mohamed was saying, we have had presidents, ministers of health in our African countries who were against the COVID-19 vaccine. And as the result, some of them died from COVID. Some of them died from the COVID. But also, as Mohamed was saying, the major challenges was what I may call the faith. Some pastors criticizing the vaccination as against their faith, quoting the Bible to say what is happening now is found in the Bible, in the book of the Revelation, saying in the book of the Revelation, they talk about the time will come when the devil will control the world by sealing people on their face and in their bloods. So people saying the vaccine is now the seal of the beast. Therefore, people who are Christian, people who are believers cannot accept that. Other thing to that is to say, we have faith in Jesus Christ, and if we believe in Jesus, Jesus will protect us against this pandemic. So you don't have to get the vaccine, because the vaccine is the devil thing, guys. And those were some major challenges. And also to add for the example of the trust, I met people saying, I cannot take the vaccine unless I see people I know, people I can trust. Therefore, I have to be involved in a campaign, asking even the nurse who was giving me the shot to take a video of that. So I put that on my Facebook page saying, I am the pastor, I am the teacher, I am from Africa. I have received the vaccine because the only way to combat this pandemic now is to get as many people as we can to be vaccinated.
Yeah, thanks, Crispin. Yeah, I mean, I think that certainly resonates with what I've heard from our focus groups in Clarkston too, in many different language groups, is this notion of being able to witness other people getting tested, getting the vaccine, and the power of that, of seeing videos, photographs, actually witnessing friends, family, other community members go through that process. And I think that's been a really important learning. Thomas, you had your hand raised.
Yes. I'm going to clarify a little bit about what others say, Mohamed and Crispin. Yeah, you know, the beginning of this COVID-19, the people had got a lot of information from those social media, Facebook. So, and there are other way, there are others who was coming with good information, truth information, like doctors, healthcare workers. They was bringing those information, but as we getting in this this service, like ambassadors, so we was like we are fighting against those information, and because they trust me, they trust us. We are working with them. We are working with the community. And then they was thinking maybe we was being sent by those people who brought those virus, you know, because they end the information like about Bill Gates, the mission that Bill Gates had about Africans. They was comparing now they want to accomplish their mission for Bill Gates that he had about Africans, not getting more children, something like that. So once we get into these missions as ambassadors, we was like fighting against those information they believe. Now at the end of this day until now, we gained a lot of people to don't believe those kind of information. So I may say like we were like into fighting. You know what I'm saying?
Mm-hmm.
Yes.
Yeah. Yeah. There are a lot of powerful forces that are working against what you all are trying to do. Powerful leaders, religious kind of tenets that are powerful, lots of misinformation. I wonder if, just kind of following the comment from Crispin about the power of seeing trusted community members get the vaccine as one important strategy. I wonder if we can kind of use that as a springboard to a conversation now about what you all have felt works in the community, and want to hear about some of the successes that you've experienced and kind of what you think has gone well. So since you were just speaking, Thomas, why don't we start with you? Anything you want to share about your work in the community with vaccine uptake thus far, where you feel like you can look back at an interaction or an experience and say, that actually went really well, or that had a positive outcome, or, that made a difference. What that, that experience, I felt like I was making a difference. I wonder if you could just share some reflections about what's gone well.
Oh yes, what done well? I think the first things we gain a trust now, and sorry. A lot of people now, even if I still don't reach to them, they are calling others. Go see Thomas. He gonna tell you about those information. You know what I mean?
Mm-hmm.
If you wanna go somewhere about like taking vaccine or test, call Thomas. Yeah, I feel proud on that because other people, they know I help them and they are transfer the information to others, and they are calling me and I'm asking them, how did you get this information? They are saying, oh, I was being taught by Alimasi, I was being taught by Adija. Also, that I feel proud about that, and I hope that we gain the trust. They are trusting me now because I'm telling them what it is. And I'm bringing the correct information, the true information from trusted source, like CDC and other care workers that I work with. So I gained those trust as I didn't believe if it will happen. But now I may say I help people that I never reached before with the COVID-19 information, So they are referring me to Thomas because they gain something that is helpful for now.
Mm-hmm.
And I hope that now again more people that's already vaccinated. I can see that.
Mm-hmm.
Yes.
Yeah, that's great, Thomas. I love that idea of, that you've kind of planted seeds in the community so that maybe every single action, every single interaction with someone doesn't necessarily result in something concrete, but it's like people know you, and it's, this idea of like, well, if you have a question, call Thomas.
Yes.
That's huge. That's progress.
Yeah, exactly.
What about you,
Exactly.
Mohamed? What about your successes or experiences that you feel like were successful, were positive?
The biggest success, I will say, not to the community, even to myself and others, getting the right information. So this information we are getting up there, getting the right source, passing over to them, so and letting them know where they could get the right sources, trusted sources, versus rumors and misinformation on social media worked a lot, made a big impression. And I think the more information we get, any information that we get and share within ourselves from those CDCs and of course Georgia State and others that are reliable, well established sources, have helped change many people's life. The first thing was is this disease really exist?
Mhm.
We have overcome that, as you've seen communities and families being touched by sickness and deaths. So they believe it's there. And is vaccine necessary?
Mhm.
That was challenging to faith-based community, those who are going to such an this, saying that they will trust their beliefs in certain religion more than this. That was another. But what I have seen that worked very well against that were two things that I want to share with my fellow ambassadors up there. Two things is always reminding them that none have touched this group, have been in this country without going the process of vaccine, either from camps, refugee camps at the host countries, or when they came up there. The first 3 months is nothing but appointment of vaccinations. So reminding them that you've been getting vaccination the first 3 months of your arrivals was important, reminding them how many vaccines did you get, how many injections did you have? So if you got those 6 years ago and it made a difference, what makes you think this one single one is different from that? So that I think we're comparing the previous vaccines that they've been receiving, whether they liked it or not, or whether they were comfortable with it or not, to the current one now. So relating the current vaccine to the ones that they have been receiving, was a very successful thing, especially for those who've been here the last few months. To a year and less was very much easier because some of them have been still going for vaccines now, so they are already getting vaccine through their agency. So reminding them this is not something unique; it has always been there, and you trusted it before. You can do it now. Was helpful. When it comes to the faith-based, is as getting the right information from the CDC or the partnering with them with maybe a pastor or maybe a chef, and posting the vaccine information near like the mosque and the church where they go every Sundays and Friday. And I think I'm gonna ask Beth, that has always come into my head, if you could get more posters, and most of the religious organizations are willing and are ready to accept those posters being posted next to a mosque. So every time they come on Friday, that big crowd sees it up there to where they trust, and there is a poster to it, made it easy. Go to a church and they've seen a poster near a church that's in coordination with the pastors up there, allowing the posters being posted. So as they go in there, seeing it made another big difference, or even involving them to talk. I've also partnered with some of these people who are big businesses, where people come. Like for instance, the common places most of our in Clarkston people meet at the Global Mall. Global Mall has so many different shops and different. So being at those places where elderly will come from 8 in the morning to 6, just spend time up there, either watching news up there, watching soccer for the teenagers. Spending some time there made a big difference. So I was able to get feedback and hear their conversation about COVID among themselves, and getting feedback was very helpful. So I used some of those business owners, or maybe a manager of that market, and asking them, what feedback have you been getting? And They also been calling me and say, look, we've had several people talking about this. What information do you have on this? Well, some of my customers, we had several ladies while they are waiting for their meat to be cut. They have an opportunity to talk and discuss about their family issues. So when it comes to COVID, this is the most common thing they're asking themselves. Mohamed, what information do you have on this? And most of those people up there who own those businesses or work there have been vaccinated, and that helps when you tell them, I have had my vaccination. My wife and children have had vaccination. Or my wife just had a baby last 5 months and she had. So this issue of breastfeeding, not getting vaccination, it helped. So, and I think those are some of the successes and health information I got up that we can share.
Yeah, no, I think those are really interesting points. You know, and going back to your first point about, you know, the power, it seems like in your experience of kind of reminding people about the fact that, you know, most of us worldwide, many of us worldwide have already received a number of vaccinations for a number of diseases, and kind of using that reflection to normalize this vaccine, make it feel more accessible and understandable to people. So I think that's a really interesting strategy. And then I think, you know, the latter points you were making about, you know, just the importance of meeting people where they already are, right? Like sharing information at churches, at mosques, at shops, businesses where people are already and kind of more naturally gathering. And going back to that issue around trust, you know, that we're sharing information in places where people are trusting that community, right? Which is certainly true for many people who are invested in a faith community. Crispin, I don't know if you're still on, if you want to chime in on any of those points, if any of that resonates with you. Just thinking about, and because I know you're doing a lot of this work in the community as well, any other successes that you have experienced that are similar or different to what Thomas and Mohamed articulated?
At the beginning, as everybody said, is really the trust. And as I said, I am a pastor of a Lutheran congregation. I am a teacher in a school for refugees called the Global Village Project. And the power of seeing people we know, we trust, receiving it, has been shifting the way people were dealing with understanding COVID. Mm-hmm. I remember receiving my first shot in March 2021, when teachers were allowed to get the vaccine. So I had to drive from Clarkston to Tacoma, like 75 miles. And I really begged the nurse who was giving me the shot to take me a short video of what was happening. Mm-hmm. And the next day on Zoom, because at that time we were having class on Zoom online, I had to share that video and the picture of my vaccination card with my student. And we had a big debate in class. I was trying to give my student the best information, my own pictures, and the student was saying, you know what? The president of Tanzania said this. So, and they told me, we are not sure, but let's see what will happen to you in 3 months. Because people are saying when you get the shot, you will be turning into a goat or something like pig, like that. So I said, okay, that's good. Let's give time to time. Then in April, I got my second shot. And I said, guys, you know what? I even received my second shot and I'm still Crispin. I'm not a goat yet. So then from all those short video, I I have been preaching in my church saying, I am your pastor, and as your pastor, I received my shot. So I'm not only preaching by words, but I'm preaching in actions. And when people see that, not things they hear on radio or on TV, but somebody they know, a teacher, a pastor, a friend, a community member who has received the shot, and after getting all these devastating news about the numbers of people who are dying, we say, oh, this guy was not wrong. It's time to all of us be involved and being ready to get the vaccine. Therefore, just the power of seeing and people they trust, real people they know, getting the vaccine has been really successful until one member of my church shared with me that it was a big struggle in his own family. People saying, your pastor has been receiving a lot of money from the white people to make you members of his church to be vaccinated. And if you get the vaccine, you will be turning into goat. So I said, oh, then so we had a I may call it counseling about the vaccine and everything. I took him to the vaccination site. He received, and the next day he said, oh, pastor, I'm still alive. I'm not yet a goat. So that kind of person became himself the ambassador to spread what I've been calling the good news of the vaccine.
Yeah, no, that's a really insightful story. Thanks, Crispin. Okay, so let me take the next 5 minutes and then we'll open it up for any questions from attendees. And I think this is a good kind of, Crispin, your story is a good transition to this final question that I have for you, Thomas and Mohamed, which is about advice for other communities, nationwide, worldwide, but let's kind of think, in the United States, a lot of communities have or are trying to launch community ambassador, kind of lay healthcare worker models, where, people from the community are charged with going into the community with their friends, family, and neighbors to try to increase confidence in the vaccine and hopefully increase uptake in the vaccine. What advice would you have for other people that are thinking about doing this work or already doing this work, particularly in multilingual, multicultural communities like Clarkston? Let me start with you, Thomas.
Yes. First of all, so I may have advice to those clinics and universities that are working to get people vaccinated. They should see how they should start this event, like we had Health for All event. Once was calling people to get a survey or interview. Most of them, they were saying that we was asking, there was a question that said, how did you hear about that event? So they were saying, oh, I was passing around. So I saw only by passing. I was going somewhere and then I saw that event. So I should advise those people around there to have some events that they should engage people. You may not meet someone that's but by doing those events, people may know and may get information that they need, and they should having some proof on the other people that get vaccinated already, on the first event of for all campaign, F for all campaign that was in Clarkston there, nearby museum, I asked one lady, and she told me I can't get this vaccine because I'm not gonna get a child. Oh, and I asked her, do you know Dina? Dina, she's my sister. Crispe, know her. Crispe, do you know Dina? Yes, I know Dina. Have you know, did you see her these days? No, I never see. She respond to me. I never see her all these months. Yes, you know her husband? She said, yes, I know her husband. Yes, now her husband has got a vaccine, and now his wife is pregnant now. She is my sister. She is now pregnant. Why are you saying that if you get a vaccine, you're not gonna get pregnant, you're not gonna get a baby? Now my sister, she is pregnant. You know what I mean? To show them the proof. If they say, no, if you we take this vaccine, we'll become like a goat in 3 months. The other lady was telling me that. I got my vaccine was 5 months ago. I told them 5 months ago. Now I'm good, you know, to show them the proof while we are transferring this information. You know what I mean? As Crispe said, there were people I was telling a lot of things that were not true. So, and then we can relate with the good proof from them. So if you say this, why this is not happen to this one or to me? In 5 months, in 10 months ago, I got a mine. And if you say you can't get a baby, why now Dina, she is pregnant? Angelina, she is pregnant. Why? What can you tell me about that? You know what I mean? So we need more events so we can reach people. That's I may advise. And once we go to those people who still don't believe, and once they ask you those questions, so we can be able to tell them the people got vaccinated, and some example of other people that's get those vaccination. That's, I don't know if I was understandable.
Yes, absolutely. No, I think that was really helpful, Thomas. You know, kind of some very concrete advice for other people trying to do this work. Like you know, we need more events where we can reach people and bring people together. And then when we bring people together, we need to share concrete stories of that can counter the misinformation. Like the story you told about the, you know, the kind of misinformation related to fertility and the vaccine, you know, that you have a specific story that's a personal story that you can share to counter the misinformation. And I think those personal stories are really powerful.
Yes, exactly.
What about you, Mohamed? What would your advice be to other people trying to do this work?
Is what I have found out is always reminding people, same skeptics, reminding them that they had vaccine on different occasions in their life or for certain diseases. Their parents or family members have had vaccines such as polio and all those, and how successful those vaccines were, always reminding them the catastrophic incidences of saying that if they didn't get those vaccine or polios, that what impact it will have had by your parents or yourself being able to take this vaccine. It made a difference. Now we are combating similar or maybe even worse than what the other vaccinations that we've been diseases we've been getting, and therefore if you have trusted the other ones, please trust this. And you have seen the impact the other vaccines that you've received have had. And what other thing that I found of success is not to brush or underestimate certain maybe website or certain from the community. So to be able to know communities, where do they get their sources? What is the most common source they receive from? And redirecting that community to the trusted, reliable sources like CDC to combat that seem to have really worked for me. They seem to have worked for me to be able to compare those. Seems to have worked. So more events, as Thomas mentioned before, more events to remind them of getting opportunity for such worked out. And I'm glad Thomas mentioned that, because where work is, we usually have some job fair. The last 6 months, 8 months, many companies were preparing, many organizations were preparing for peak seasons. With COVID, the impact it had in the companies or in the community not going to work, labor shortages and all those, they had their own strategies of trying to fill up the gap. And I was able to learn from it. Like whenever they had a job fair somewhere, I was there to pitch in, even when my company is not doing a job fair. Like we're gonna hear there's a job fair in Taka, you know, or I go to the labor office, there are posters up there and they say there'll be a job fair for such and such company in that particular area. If it's within the vicinity of Clarkston, and I'm able to go up there and have a few minutes to spend, a few hours to spend, I will go there and observe if our communities are going up there to look for jobs. I'll pitch in and talk about, well, you need any help applications? Do you need any of these? And by the way, did you get your vaccine? Did anybody in your family get vaccine? Yes, yeah, I did. Is everything okay? What challenges do you hear about your other friends who don't get the vaccines? What do they say and why are they not taking them? Getting information and feedback to the ambassadors in the communities and getting trusted information to the community, I think works great, in my opinion. Thank you.
Yeah, thank you so much, Mohamed. I think that certainly underscores what Thomas said about the importance of community-based events where people really have the opportunity to come together, speak with one another face to face. Those kinds of interactions do matter. And it can't be our only strategy, but it's certainly, from what it sounds like you both have experienced, and Crispin too, that there's a lot of value in those kinds of community events. Okay, so we are at the top of the hour. So I do want to go ahead and pause so that I respect everyone's time. Just want to share our website and my email address with attendees here on the screen. So feel free to reach out. And just most importantly, want to thank Thomas and Mohamed. The two of you have been a really important part of our team, and we just are so appreciative of all of the work that you're doing in Clarkston and the surrounding areas, and know you are just making a huge difference, and we're really grateful for you. And I'm really thankful that you offered and were willing to spend an hour with us today. I really enjoyed hearing from you. I know others did as well. And also just want to thank Crispin as well for chiming in. And please do join us for future Brownbag seminars. Be on the lookout for advertisements about those events. And I hope all of you have a great rest of your day. And thank you so much, Thomas and Mohamed.
Thank you all.
Thank you so much. Thank you.
Bye.
Bye-bye. Thank you.